The city of Newton has seen a rise in overall calls in the past few years and an increase in both house fires and deaths due to these fires. Fire safety education plays a crucial role in preventing fires and minimizing their impact. By educating individuals and communities about fire hazards, safety practices, and emergency response, we can significantly reduce the risk of fire related incidents and enhance overall safety. Engaging educational programs tailored to specific audiences, such as children and seniors, can foster a culture of safety and preparedness within the community. Community risk reduction is a process to identify and prioritize local risks, followed by the integration and strategic investment of resources to reduce their occurrence and impact. CRR is different from traditional ideas of fire prevention because it is concerned with a comprehensive approach to reducing the overall incidence and impact of emergencies within the community. The fire service has a rich history of striving to reduce the risk of fire in the community. This has been achieved through emergency response, fire safety education, adoption of fire codes, and enforcement of those codes. Today, fire departments recognize that their primary goal is to save lives and property from more than just fires. This broader all hazards approach has become evident as the fire service has responded to extrication, drowning, heart attack, stroke, hazardous materials release, trench and building collapse, high angle rescue, and water and ice rescue, active shooter, and weapons of mass destruction incidents. A basic review of CRR is provided here for insight into the methods of risk reduction. 1. Identify risks. 2. Prioritize risks. 3. Develop strategies and tactics to mitigate risks. 4. Prepare the CRR plan. 5. Implement the CRR plan. And 6. Monitor, evaluate, and modify the plan. The community risk reduction program I am instituting is in two areas of public safety. The first, looking at the number of house fires and deaths due to these fires during the winter months. The program is designed to both educate the public as well as to get the public involved by setting up volunteer networks to help with our message. These risks lower community confidence, raise insurance rates, and weaken community resolve. The problem and purpose. Educate the public in the use of both smoke detectors and alternate heating sources to help decrease the number of fires and deaths. Looking at the cause of these fires and the solutions that cover the community and its most vulnerable residents: children, elderly, and low income. Looking at the causes of this increase in fires and deaths during winter months. For example, overloaded electrical systems, space heaters, lack of smoke detectors, etc. Break down barriers with communications, economics, and accessibility to allow risk reduction information and protocols to reach the whole community. And safety education should reach children as well as adults in order to educate everyone about the attitudes and behaviors that help prevent fire. Fire safety education encompasses a wide spectrum of programs and activities directed towards diverse audiences such as preschoolers, school children, senior citizens, homeowners, apartment residents, physically challenged people, hospital and nursing home staff, and civic organizations. Each community has special needs and different characteristics that should be considered in relation to every service and program provided by the fire department. The most significant information comes from understanding which types of people live and work in the community. The fire officer should develop a good understanding of the population and demographics of the particular areas where the company responds. The city of Newton has a population of 88,923 residents. It has 33,320 housing units. It had 377 house fires and 3 deaths due to house fires. The fire department demographics. The Newton Fire Department has 160 firefighters and 45 officers. It has 6 stations strategically located throughout the city and answers 11,000 runs, and it has been increasing on an annual basis. It also has 4 ambulances which run out of the fire stations. Risk prioritization and community effects. Lowering the number of house fires during the winter months, lowering the number of deaths due to these winter fires, creating programs that involve all sectors of the community, prioritizing risks involved for residents and for responding emergency services, and keep our community A rating with insurance companies. Mitigation tactics and strategies include all members of the department for buy-in and participation. Education programs for residents of all sectors of the community. Live burns so that people can see the effect and speed of fire, and also demonstrations on the proper use of alternative heating devices. Work with stakeholders and other members of the community. Set up free smoke detector giveaways in all sectors of the community to allow everyone access. Build a proactive community-based educational website that covers all languages in our community and allow for information on the use of alternative heating sources as well as information on fire safety. Benchmarks are the key to assessing the success of a CRR program. The benchmarks within the CRR should be lowering deaths from fires, lowering the number of fires during the winter months due to lack of knowledge on alternative heating sources, checking call logs and reports to see if any fires are caused by our root problems and to see the rate of delays and injuries, and meeting with members of all sectors and villages in our community to assess the CRR and discuss the measures we have put forward in our CRR and ensure we are hitting our target audiences and allowing for any updates or changes necessary to keep the plan working as it is designed to. Budget requirements. We need to request funding from the chief and budget for fire prevention programs, have a grant writer for state and federal grants, have fundraisers, contact local businesses and stakeholders, and work with organizations that produce both smoke detectors and other fire prevention resources. Cost versus outcome. The effects are saving lives, lowering the cost from house fires. House fires can have a negative effect on communities and cost, confidence, and safety. Organizational self-development, workload reduction, increased efficiency and partnerships, and creating a safe, stronger, and more resilient and educated community. More confidence and understanding between the community and fire department. Thank you.